blood cultures. So when you go to do your blood cultures, remember you have to take your lab slips and all your supplies to the bedside so that you can check the label against the patient's date of birth and name. So make sure you do that. When you walk in the room, make sure you do hand hygiene. And when you take off or remove your gloves, you do hand hygiene. So I won't go over that part again. We all know that part. So these are the supplies that you need to bring in with you. Blood cultures should be drawn peripherally. You don't want to draw them from the central line, even though sometimes the doctor will just pick one set from the central line, one from peripheral. Your blood culture should always be drawn peripherally unless the physician is specifically checking to see if the central line is infected. Other than that, even if they give you one that says draw from the central line, draw peripherally. Check with the doctor to make sure they're not trying to figure out if it's a specific line infection. Okay, so when you go in, identify yourself, do your hand hygiene, ask the patient to identify themselves. Find a spot where you can, on the tray table, clean the area and lay out your supplies just the way you're going to use them. Okay, so I always line everything up and prepare everything ahead of time. Check the patient to see which arm you want. You got to do one from each side. So a peripheral on one side, a peripheral on the other if you can. If they only have one arm, then you're going to take it from, go above first and then go below. Okay, or go below and then go above. Okay, so make sure you do two different sides. You don't want to be drawing it from the same side. All right. So when I get ready to do this, I'm going to pop my top, and I'm not going to waste this one. Take an alcohol prep. You want to go ahead and scrub the top of your bottle and leave it there. Take the second one, scrub the top of your bottle and leave it there. Do the same thing for your other one. And then I open my syringes. Remember, all your connections have to remain sterile so you don't contaminate. So just open them up, leave them in the sterile package. Okay, I'm not going to waste these, but you're going to do the same thing for this set. Okay, and then have two ways of putting it into the bottle. So you're going to draw from your syringe and then transfer to your bottle. They do have those angel ones that'll fit on there. We just use these. This works just as well. Okay, don't use a needle. Stay away from needles. Okay, we have ChloraPrep for cleaning the site, and then you need one of each of your needles, butterflies. Okay, so hand hygiene. You've already decided where your site is. Put your tourniquet on. Okay, she's got her tourniquet on. All right. So, and then I'm going to go here. So I'm going to take a ChloraPrep, scrub the site. You want to let it dry. Okay. Then take your butterfly. All right. You want to take the end off. Be careful not to stick yourself. Take your syringe, attach it so you don't touch either end, okay?
Thicker.
I'm gonna have my gauze ready. We're gonna stick, okay? And then just draw back. You need to draw back 8 to 10 mLs of blood, all right, for each bottle. You don't want any more than 10, you don't want any less than 8, all right? This is an aerobic bottle and an anaerobic bottle. If for some reason you draw your sample and you can't get enough for 2 bottles, let's say you only get 8 mLs in one syringe, and the second syringe you go to draw and you can only get 3 and the site blows, okay? Take the 8 mLs that you got in this and put it in the green, the aerobic bottle, okay? And you can send that down as a sample. Does that make sense? Okay, so we draw, then I'm gonna just pinch off, take this one off, lay it in back in my sterile container, pick this one up, attach, draw another 8 ml, then take my butterfly off. Okay, hold that please. Push on pressure. Okay, and then I'm gonna pull the rest of the blood in. I want to take this off. Aseptically attach my bare cannula, lift off my, pop it in, and it'll pull it in. Same thing for this one. Aseptically attach, and I've got my sample. Okay, take these off. When you label your bottle, if you look on your bottles, it's very easy now. Take off your label. Can you see that? It says actually label here. So you're going to put it at the top. Okay, put it right to the top and do the same thing on your second bottle with your second label. Okay, then you're going to fill out your label with the date, the time, and where you drew it from. Left forearm, right AC, right digit. Wherever you drew your lab from, you want to put it on there. Okay, and be very specific. And then it's going to repeat the same thing for your second culture. Any questions? Pretty easy.
And this is Mary Beth. She's from the AVAT team. She's been doing this for a long time. So if y'all have any questions, she's really got a lot of expertise and can answer those questions.
It just means I'm old. So. Any questions about it? If you set it up exactly the way you're going to use it beforehand, it's the easiest way to do it. And you really need a clean area. So don't lay the stuff on the bed, you know, where it's going to tip over and wind up getting contaminated. If you take your syringe and you put it on here and it comes out onto the table, can't use that. It's contaminated. Okay, that will skew your result. So you have to be very careful to make sure your connections are sterile and that you use your sterile containers to put them back into. Okay? That's it. Easy as pie.
Thank you.